want to talk a little bit about telemedicine and its role here. Do you see, and do companies like Zeiss and others see the future of doing remote monitoring of patients as important? And do you see on the horizon instruments that are going to capture an OCT or a retinal exam that a patient could own at home?
Most definitely. And you know what I feel good about is that I was saying this along with my team at Angelo Rego and Andy Chang and Aaron Powers. We were saying this pre-COVID. So it's not like, oh, I'm jumping on the bandwagon now and I'm the smartest guy in the bear. We were saying this before. Again, goes back to what I said earlier. More patients, less doctors. It was going to happen no matter what. You cannot see every patient as they walk in. And in fact, it makes you more productive if you're able to see Mrs. Jones via this remote. So at the end of the day, at 7 o'clock at night, when you're done with your practice, you get on the computer and Mrs. Jones, OCT comes up. You can send her a text and say, listen, don't need to come in next month. Thanks. We'll see you in a month. I mean, that's productivity. Plus, as we're getting older, we're not as accessible. I mean, I have Kelly's parents are still with us. So lucky. But they're now in a nursing home. They don't have the same access. I don't want my father-in-law driving. So, but why should they be driving to meet with you when you could have easily identified and told her, listen, Nancy, you're looking good. You don't need to come in. Or guess what? Maybe even better. No, Nancy, we need you in now versus she waited a month for her next visit. So I think this is proactive measures to be able to manage patients accordingly. And I also will say something too, which is great for our healthcare systems. It's going to drive costs down. And we need to drive costs down across all healthcare because that's a pandemic there, the healthcare costs. We can't afford to continue to operate the way we've been operating. So this crisis is actually going to accelerate something that needed to be done.